Can taking a B6 supplement cause a B6 deficiency? This sounds a little ridiculous, but this is a possibility. It has been shown that people that take really high doses of B6 can end up with symptoms that look a lot like a B6 deficiency. The biggest one being sensory neuropathy. That's like numbness and tingling in the fingers and toes. The extreme examples of this occur when you're taking like 500 milligrams of B6 or more. That's a lot. However, there are subtle examples of this happening at much lower doses, 40, 50, 60 milligrams. When you have symptoms at those lower doses, it's almost immediately reversible when you simply stop taking the supplement. But the question is, of course, what is going on? And the answer seems to be related to how B6 works in the body. B6 refers to a few different chemical compounds, pyridoxines, pyridoxals, pyridoxamines, and while they're pretty similar, they are slightly different. The bioactive form in the body is pyridoxal 5-phosphate, also known as P5P, and this means those other forms need to be converted into P5P to work in the body. But many widely available B6 supplements utilize pyridoxine hydrochloride. This is inactive and needs to be converted to P5P in the body to do anything. But here's when we run into the potential issues, because pyridoxine hydrochloride can bind to those B6 receptors in the body. And when those receptor sites are occupied by pyridoxine hydrochloride, they can't be occupied by the bioactive form, the P5P. And if you totally overwhelm the system, all of the receptor sites are occupied by pyridoxine HCl. But this means that even though there's a lot of B6 in the body, the bioactive form is not allowed to do its thing. And there are pretty much two ways to make sure this doesn't happen. One is to not take too much B6. However, like I mentioned, some people have this negative reaction at doses much lower than what would normally be considered toxic. And in those cases, it appears that instead of supplementing with pyridoxine HCl, if you supplement with P5P, that bioactive form of B6, then that receptor site blocking does not occur. And while you're supplementing with B6, these are two things to keep in mind. Keep those doses at reasonable levels and look for a P5P.